Good morning. This is Kara Stoller at the Steamboat Springs Chamber. Thank you all for joining us. It's been a little while since we've had a webinar and, a lot focused on health. And in one hand, that's a good thing, but it's definitely time and it's always applicable to revisit. And we really have been hearing recently, questions about changes in terms of quarantine requirements and just general practices on how best to keep teams healthy moving into this winter. And along with that, legal requirements for employers. So we pulled together this webinar and we're incredibly grateful for our speakers that we have today. We have a phenomenal lineup. And with that, we're going to kick it off here in a minute with Roberta Smith, our Routt County Public Health Director. After that, we'll have Kelly Gallegos with the UCHealth Yampa Valley Medical Center. She's the Chief Nursing Officer. And then after that, we will have Barbara Bagden. She's with the Employers Council, an attorney with the Northern Regional Office. So thank you all for being here. Thank you for the attendees for joining us as well. And with that, Roberta, I'd love to bring you on. Again, Roberta Smith is the Routt County Public Health Director and is going to kick it off for us today. Roberta.
Great. Well, thanks everyone. And, it has been a while. So I think this refresher is probably, due. We've got lots to talk about keeping yourself, your staff safe and healthy this upcoming fall and winter season. So I titled this the Public Health Minute. It'll probably be like 10 minutes, but just kind of a high level overview of what we're seeing. And I've got some resources in here as well that we'll talk about at the end that will hopefully be helpful to everyone. So I wanted to start off with the fact that we do have a tool, and this tool is vaccinations. And this is what is really going to help us fight this pandemic that we are currently still in. We are still in a pandemic. We just saw a wave of Delta that continues to affect our community here in Routt County. Cases are increasing within the state of Colorado still. We are, hoping that we'll see some relief here soon, but we have seen this increase in cases recently that is concerning. And a lot of this is due to people not being vaccinated and having that vulnerability within our population. Right now, we have a huge part of our population that cannot get vaccinated, are children that are less than 12 years of age. And hopefully we'll see a vaccine coming out for them here shortly. In fact, hopefully by next month, we'll have some approval for that. But right now, those people that are eligible for vaccines should be vaccinated. And right now, we're in a spot where ACIP, which is the Advisory Committee on Immunization Practices, and FDA have looked at what we currently have as our vaccines available here in the United States, and what does that look like for boosters. So it's a little bit confusing. We've got the terminology of an additional dose as well as a booster dose. And additional doses right now are recommended for people of any age who are immunocompromised. So if you have an illness or you're taking a medication that compromises your immune system, it is recommended that you get an additional dose of either Pfizer or Moderna if that was your vaccine series that you previously had. Booster doses right now are only recommended for those who got the 2 doses of the Pfizer vaccine. The FDA is going to be meeting next week to discuss Moderna and the Johnson & Johnson boosters and what those might look like in terms of needing those for certain populations that received Moderna or J&J as their initial series. So we'll be putting out information about that as those approvals and recommendations come through. Currently, we've got over 11 providers of vaccines in our community. And as you'll remember, back in December, distribution was pretty limited. It was UCHealth and Public Health that had the majority of the doses. And then we saw it going into pharmacies and providers. So now going to your primary care provider, you should be able to get a COVID-19 vaccine. All of our pharmacies here in Routt County are carrying the COVID-19 vaccines. And we've got all three types of vaccines are represented here. We occasionally have the vaccine bus that comes through town. We just had it this week at the high school. The vaccine bus will be coming back on October 20th, and that will be in Yampa in the morning and then Oak Creek in the afternoon. You can always find vaccination locations on our county website as we keep that information updated. I also wanted to make everyone aware about the Power the Comeback campaign. And this is really an employer-focused vaccination campaign that CDPHE has put together. They have PSAs, they've got letters, they've got information that you can share with your employees about vaccinations. There is also a business pledge that your business can sign to say that, you know, your employees will be vaccinated and you're striving for high vaccination rates within your business setting. So there's a link here to that toolkit on CDPHE, and they have PSAs that have been running, so you may have seen that on some of the local media. I wanted to give an update on COVID-19 testing options. We do have a variety of locations throughout the county that are doing testing. Again, you can visit our Routt County website. We have contracted with CDPHE and a company called Mako, and they are currently providing testing on Friday, Saturday, and Sunday at the Strings Music Festival parking lot. I want to give a shout out to our friends at Strings and to Steamboat Ski Corps who helped us make that happen. We expect that this testing location will be there through November. We'll reassess at that time, you know, what the need is here in our county. But for anyone that wants to be tested, you can go. It's PCR testing. Turnaround is around 24 to 48 hours that we're seeing with Mako. Also, what's new and a tool that we didn't really see last year at this time was we now have over-the-counter self-tests. And CDPHE has a link where you can order these for free. The link is here. You can order those tests. There are some videos that help walk you through how to do those tests. Also, if you are doing an at-home test, I want to remind folks that those reports, both negative and positive, should be reported to us here at Routt County, and we've got information on our website regarding at-home tests and how to report that to us so that we are aware. Also, CDPHE, you can order at-home tests for organizations and get those tests in larger quantities. So that could be an option for any employers that are looking at different testing options. I wanted to remind people we've got these wonderful posters, all of our 7 commitments of staying healthy, and we still are seeing people come to work sick, and then they've got COVID, and we still have to work up outbreaks in facilities. And, you know, we are still doing isolation and quarantine. So really bringing that message home that if you are sick, to stay home. This year, we're not wearing masks as often as we were last year. And we're seeing other respiratory viruses. I think Kelly's going to give us an update on influenza, but we are seeing RSV, parainfluenza, those other respiratory diseases circulate, and they're transmitted the same way that COVID is. And I still hear people say, well, I just thought it was a cold. Well, you know, coronaviruses, SARS-CoV-2, other coronaviruses will give you cold-like symptoms. So again, making sure that you're not infecting others and staying home when you're sick. I wanted to give a brief overview about isolation and quarantine. This information really hasn't changed from what we saw last winter. A little bit plays into it with vaccines, but regardless of vaccination status, if you test positive for COVID-19, you need to isolate for 10 days. And so that 10-day period starts either, if you're asymptomatic, it starts the day of your testing positive. And if you had symptoms, your 10 days starts from the first time you had symptoms. So the symptoms, if you need a refresher, I've put a link there to CDC to understand what symptoms are. And, you know, making sure that you still have your business mitigation plans is a good thing. We get a lot of calls from employers like, oh, someone tested positive, what do I do? In going back to those plans that you had previously to understand what you would do in terms of staffing and contact tracing within your organization when you have a positive COVID test. So again, these are the particulars, and I'll work with Kara to get these, make sure that these slides are sent out to you, because I realize there are a lot of hyperlinks in here and a lot of text, but I wanted to just outline those symptoms and the understanding about isolation. So if you haven't fully recovered after your 10 days, you would need to stay home longer, and we want you to be 24 hours without symptoms or having symptoms improving at that time before you go back into the world. So quarantine, this is what has changed a little bit in the face of vaccinations. If you are fully vaccinated, you don't need a quarantine. And this is great for some of our businesses, of course, that might be short-staffed already. If we have a fully vaccinated workforce, then people that are exposed to COVID-19 and they're vaccinated do not need to quarantine. It is recommended, however, that you do take a test for COVID-19 within 3 to 5 days after that exposure, and as a preventative measure to wear a mask in public for 14 days, just to cover any kind of incubation period or asymptomatic spread potentially. If you're not vaccinated, we still have our quarantine strategies, the gold standard being 14 days for quarantine. And this is, you know, for our high-risk individuals. 10 days is kind of that next tier down, and that's more appropriate for people that don't have contact with high-risk individuals. And then 7 days is our option that if you are on quarantine, you can test on day 5 or later. And if that test is negative, then on your 7th day, you would be able to get out of that quarantine. So again, making sure and going back to your mitigation plans to make sure your information on, you know, from an HR perspective, what you would tell your employees is up to date with this information, I think is always helpful. Hopefully you don't have to use it, but if you do, then you'll have the latest information. I know we've got Barbara on the call here as well, but I wanted to go over some of the state and federal guidelines that you may have heard about. We still continue to have public health orders. Routt County currently does not have local public health orders, but we fall under the state public health order. So there are certain entities such as homeless shelters, prisons, jails, community corrections, emergency medical and healthcare settings where there is a requirement for mask use by unvaccinated folks. There might be some testing components that an employer has based on that public health order recommendation. And I want to really emphasize that the state, we've always had public health laws that require participation with isolation and quarantine. And these are not new to COVID. We've always had these in the presence of measles outbreak or tuberculosis outbreaks. And the fact that public health is still contacting people and giving them isolation orders and quarantine orders, these are still enforceable laws that we have here within public health. So I think some people might wonder, without having a local public health law, how that works. Well, we fall under that whole auspice of the state public health law overall. And the states did come out with a vaccine mandate for state employees and contractors of the state. There is a COVID-19 vaccine requirement as well. In healthcare settings, there is a vaccination requirement for healthcare workers. All of those details and that specific information can be found on the CDPHE website. I wanted to touch on some of the federal updates as well. I have a contact at OSHA and I talked to him last week. The OSHA emergency rule is still to be determined. Barbara might have more of an update about that. But really, it does take some time for OSHA to write emergency rules. So even though it was announced in the media, we are waiting for that to be finalized. And when that is, I will certainly let people know what that might look like in terms of how you operationalize that. We still have our mask requirement on transportation. TSA, the federal government, extended the face mask requirement through January 18th of 2022. So this still requires mask wearing on our public transit and school buses, anything that would fall under the auspice of public transportation. And CDC continues to update guidance for businesses and workplaces, and they've got some really great tools. If you haven't visited that webpage lately, I've got the link here. I've got kind of a screenshot of it here, but they have testing updates, contact tracing updates, and post-vaccine considerations that you can have in a workforce. I would recommend looking at this toolkit to update any mitigation plans that you might already have. They also have some letters, templates that you can use for employees, encouraging them to get vaccinated. And I think they've got a wealth of information, and it's really good one-stop shopping for that information. So I'll end here with the resources that I talked about, really good links, and they'll be helpful kind of moving forward here as we still continue in this COVID-19 pandemic. So thank you.
Thanks so much, Roberta. Really appreciate it. That was a fantastic overview and update. And we are going to shift over to Kelly Gallegos. She is the Chief Nursing Officer at UCHealth Yampa Valley Medical Center. And again, I know Angelica shared it in the chat. And I failed to mention it at the beginning, but please, we encourage all of you to put questions in. There's a Q&A at the bottom of the screen, and to add them in there. You can add them anonymously if you would like to do so, but we'll get to the questions at the end. So Kelly.
Hi, good morning. It's a pleasure to be with you. Thank you for having me. I'm just going to tag on to Roberta. We have a little bit of overlap, but just want to talk to you about preparing for winter and how that impacts your health. So a little bit on COVID, just some YVMC hospitalization data. We get asked this question quite a bit and thought it might be best to be able to show you some trends. Obviously, Q4 in 2020 was our peak time, but we have experienced a little bit of a surge, as Roberta mentioned. It really felt more heavily throughout the state. I think Routt County has done a really good job trying to prevent hospitalizations. Not sure I know all the reasons, but I think the fact that we have a very healthy population. We've done a really good job with vaccinations. We've done a good job with, a lot of social distancing and mitigation plans have really helped that. But we are currently, the UCHealth system has 271 patients right now with COVID-19 in the hospital, which is a lot higher than we'd like it to be, kind of filling it throughout the state with the recent kind of increase in the southern part of the state that we've been seeing in the north for quite some time. So it is stretching our resources, particularly with nursing and other staff and bed availability. Something we hope definitely decreases over time, and we're keeping an eye on it with our partners in rural areas as well who transfer patients in, and just trying to make sure that we're doing the right things to keep our population safe. We are also seeing a little bit of a trend in age, that younger patients are being hospitalized, starting to see more patients in their 40s and others. Vast majority of our hospitalized patients are unvaccinated. We are seeing breakthrough cases, but the vaccines tend to prevent severe illness. They're keeping us out of the hospital, definitely keeping us out of ICUs and keeping us from being ventilated. We are also seeing pediatric patients be hospitalized with COVID-19 and other illnesses like RSV, and I'll talk about that a little bit more. So respiratory viruses are really on the rise across the nation. We are seeing an increase, of course, in COVID-19, but we're also starting to see RSV and a little bit of flu throughout the state. We have not hospitalized anybody here at YVMC with the flu, but we have had flu patients in our system. We have had RSV hospitalizations though, and I think that as we take off the masks and we socialize more and go back to school, we're really starting to see that increase. So super important to do the things we've always talked about: washing your hands, wearing masks in social situations, getting vaccinated, and just really aware of symptoms and getting help when you need to, and staying home when you don't feel well. We're also wanted to bring to your attention that it's important to stay up to date on vaccinations. We did see a decrease in compliance with the early childhood vaccinations last year. Part of it was because we did a lot of things virtually and just were staying home, but this really puts us at risk for some diseases that we have done a good job controlling, and it really puts at risk our children and those with immune compromise. So we had a decrease of 16.2% of children who were vaccinated with MMR, measles, and we also saw a big decline in varicella chickenpox. So trying to encourage everybody to make sure you're up to date on all of your vaccinations and just doing our best to stay healthy. And this is just another slide to show all pathogens across UCHealth and just how we're seeing that big spike as we're taking off the masks and getting into our regular lives, what we're seeing. So just to be really aware of that. I think that's the end of the slideshow, but I really wanted to be able to also say that we do provide testing for COVID at YVMC. We're able to get on My Health Connection app and schedule it. We offer testing 5 days a week. We are still providing vaccine clinics for COVID-19, and we're really here to answer your questions anytime that you have them about COVID or other illnesses, and just looking forward to being your partner. And I'm open to questions if you have them.
Thanks, Kelly. Appreciate it. That was a great overview, and the team at UCHealth has done a fantastic job of outreach and coordination with public health over the last year and a half, and certainly beyond that. So thank you for being here and presenting. And our last presenter, we have Barbara Bagdon. She is an attorney with Employers Council, and here to provide an overview on lots of updates in terms of employer requirements and new laws. There's been a lot of change in the last year or so, and really appreciate you being here. So thank you, Barbara. Oh, we have you muted, so.
Okay, how about now?
Perfect.
Okay,
Thank you.
sorry about that. Okay, well, thank you so much for inviting me to speak with you today about recent changes in employment law. And as I'm sure you know, changes are happening almost on a daily basis legally, particularly with regard to COVID. So today, I'm not going to be exclusively talking about COVID, but today I want to cover the following issues, and I'll try to get through them in my 20 minutes allotted, but I'm not going to be able to go into depth. So please save any questions you have for after the presentations. Here are the topics I'm going to go over today. I'm going to talk with you about how the change in administration has affected the way existing laws and regulations are interpreted and will be enforced. And I'm going to address COVID vaccine mandates, both federal and Colorado. And I'm going to talk about Colorado's Healthy Families and Workplaces Act, public health emergency paid leave requirements for COVID-related absences. I also want to talk to you about statutory requirements that have recently expired and that you no longer have to comply with. And I'm going to talk about new Colorado laws and coming changes to Colorado law that are going to be coming up in the next year. Okay. Hold on a second, please. Okay. Oops. Sorry, I'm having a little technical difficulty. All right. Okay, let's talk about the change of administration and how that affects business. Well, historically, Democratic administrations are more employee friendly. And with the Biden administration replacing the Trump administration, we've seen a shift in the direction, policies, and regulations. And we've seen increased administrative agency enforcement. We see more support of union organizing and collective bargaining. There's going to be an elimination of restrictive agreements and an increased focus on workplace safety and health. So on July 9th, President Biden issued an executive order to promote competition in the economy, in the American economy. And labor markets are among the various areas in which the administration wants to promote competition. The administration found that approximately half of private sector businesses require at least some employees to enter into non-compete agreements. And approximately 36 to 60 million workers currently operate under some sort of restrictive covenant or non-compete. It's perhaps not as important and prevalent in Colorado because Colorado already disfavors non-competes, and we have a non-compete statute that with very limited exception already prohibits non-competes. But President Biden's executive order encourages the FTC or the Federal Trade Commission to ban or limit non-compete agreements. So that's going to be coming from a federal perspective. In addition, President Biden's executive order encourages the FTC to ban unnecessary occupational licensing requirements and to strengthen antitrust guidance to prevent employers from collaborating with each other to suppress wages and reduce benefits for employees. So now let's turn to COVID vaccine mandates, which is the topic of today, not only here at this presentation, but the topic of the day everywhere, it seems. On September 9th, President Biden surprised many when he announced a sweeping COVID-19 action plan, the path out of the pandemic. And vaccination is the key component of this plan. Biden's plan goes beyond just requiring federal employees to get vaccinated. It also requires vaccination for federal contractors and healthcare employees, and all private employers with 100 or more employees, regardless of the industry that they're in, must mandate that their employees be vaccinated. So let's go through the requirements for these various types of employers. First, I'm going to talk about federal employees. President Biden's executive order requires all executive branch federal employees to get vaccinated, subject to limited disability and religious exemptions. Perhaps most notable is that there's no alternative for weekly COVID-19 testing as an opt-out for vaccination for federal employees. Rather, vaccination is the only option for executive branch federal employees. And on September 16th, the administration released new guidance indicating that the vaccine mandate applies to all federal employees, even remote employees who happen to be working from home and may not even be coming into the workplace. But the mandate applies to them too. Documentation is required to verify vaccination, and employees will be disciplined or removed from federal office for refusing to comply with the vaccination requirement. Next, I'm going to talk about federal contractors and subcontractors and how the rule applies to them. The executive order applies to employees who are under contract with the federal government and its agencies. Covered contractor employees must be vaccinated by December 8th unless they're legally exempted. And again, the two exemptions are if you have a medical condition that contraindicates vaccination or a religious exemption. All employees, and this is important, all employees working on the federal contract and any other contractor employees at a contractor workplace where employees working on the covered contract are likely to be present must comply. So even if you are not working on a federal contract, if you're in a workplace where there are employees working on a federal contract, you must be vaccinated. And once again, there's no testing opt-out. Now I want to talk about, let's turn to healthcare workers. So this is the federal requirement for healthcare workers. Vaccination of all staff within Medicare and Medicaid certified facilities are required to be vaccinated. The Centers for Medicare and Medicaid Services, in collaboration with the CDC, are adopting an interim final rule with a comment period, and we expect that this will be issued later this month. So this is coming up quite soon. Now, private employers. This is the component of Biden's plan that caught many employers' attention. The direction to the Occupational Safety and Health Administration, OSHA, to issue an emergency temporary standard, or ETS, requiring private employers with 100 or more employees to ensure that their employees are vaccinated or undergo weekly testing. Now, there's a lot we don't know about this private employer requirement, including exactly when OSHA is going to issue this standard. But we do know some information. We know 5 points to be exact. First, we know that this rule is going to apply to employers with 100 employees employer-wide, not just 100 employees at a particular location, but if you have 100 employees anywhere in the United States, it will apply. We don't know, however, how the term employee is going to be defined within this requirement, including how joint employment is going to be handled. Second, we know that this isn't specific to certain industries. So even if you are a typically low hazard office employer who doesn't normally have OSHA on your radar, you're going to need to comply. Third, we know that employers can choose just to mandate the vaccine without offering a testing option for those employees who forego vaccination. And that may simplify the process administratively for many employees and make it less expensive also. Fourth, there will have to be exemptions for religious or disability reasons. And finally, fifth, we know that the rule should contain some element of paid leave for persons who, to get vaccinated, for employees to take leave to get vaccinated, and to take leave if they are suffering from side effects of vaccination, and that would be paid leave. Okay. There's already been a legal challenge to the White House's proposed vaccine mandate. However, a legal challenge to New Mexico's state vaccine mandate was rejected by the federal district court, and the United States Supreme Court has refused to block vaccine mandates in response to challenges to Indiana University's vaccine mandate, New York's public school vaccine mandate, and Rhode Island's vaccine mandate. So, so far, what you should take away is that challenges to vaccine mandates have not been successful. But stay tuned because there is currently a legal challenge to this new proposal. In the interim, you need to comply. Employers who don't comply risk inspection and costly penalties. And as you can see on the slide, violations of the OSHA standards can lead to penalties of $13,653 to up to $136,532 per violation if the violations are willful. So this isn't something that you want to have to deal with. Okay, now I'm going to talk about Colorado's vaccine mandate. Colorado has in place vaccine mandates for employees who work in healthcare settings, for Colorado Department of Corrections, Department of Public Health and Environment, and Department of Human Services staff that interact with vulnerable populations and populations in congregate living facilities, for state contractors and subcontractors entering state facilities. Anybody entering, a contractor or subcontractor entering a state facility must show proof of vaccination to enter. And also there's a vaccine mandate for state employees who have to be vaccinated or submit to twice weekly testing. So those are the mandates in Colorado. Okay, now let's talk about paid leave for COVID-related situations. As you may know, beginning this past January 1st, Colorado's Healthy Families and Workplaces Act requires employers with 16 or more employees to provide paid sick leave to their employees, and all employers must provide paid sick leave to their employees beginning January 1st, 2022. So even employers with 15 or less employees have to comply as of January 1st, this coming January 1st. But the act also required all employers, regardless of size, to provide supplemental public health emergency leave starting this past January 1st, so that they had to bring the paid leave available to their employees up to 80 hours, depending on how much paid leave they already had available to them. They had to supplement that paid leave to bring it up to 80 hours for public health emergency purposes. And you can interpret that today as COVID-related purposes. The public health emergency leave requirement remains in effect until 4 weeks after the end or suspension of the public health emergency by a federal, state, or local public health agency. So as long as a public health emergency is still declared by either a federal, state, or local public health agency, that requirement remains in effect, the requirement to provide public health emergency leave. So although Governor Polis declared the end of the public health emergency in Colorado on July 8th, the federal public health emergency remains in effect. And the US Department of Health and Human Services extended the public health emergency nationally through October 20th, 2021. So that's coming right up. Therefore, Colorado employers must continue to provide paid public health emergency leave to employees who need to take leave for the designated COVID-related reasons that are set forth in the Healthy Families Statute. However, we do anticipate that this public health emergency leave on the federal level may be extended beyond October 20th. So stay tuned. And in the meantime, you need to continue to provide paid public health emergency leave to your employees. So what's recently expired that you no longer have to comply with? Well, first, the FFCRA, or the Families First Coronavirus Response Act, has expired. This FFCRA was a federal statute that required employers with less than 500 employees to provide COVID-related paid sick leave. And it was mandatory for you to provide that paid sick leave through December 31st of 2020. But the American Rescue Plan Act extended the tax credits for providing paid family leave under the FFCRA through September 6th. So after December 31st, FFCRA paid leave was voluntary, but you'd still get your tax credits if you were a private employer through September 6th. But September 6th has come and gone, and that has expired. So the FFCRA tax credits are no longer in place. And there is no more FFCRA paid leave required. Another thing that has expired is the American Rescue Plan Act COBRA subsidy. Under the COBRA subsidy, there was 100% subsidy available for COBRA continuation premiums that employers could apply for. They would pay the premium and then they could get a subsidy of 100% of the employee's COBRA continuation premium. And that ran from April 1st through September 30th. But that has also expired and it's no longer available. So it's no longer available to employees or to you as the employer. Okay, now I want to run through very quickly some new Colorado laws that were passed at the most recent legislative session. These are not COVID related. Okay. First, there's House Bill 21-1108, which expands protected classes under the Colorado Anti-Discrimination Act to add gender expression and gender identity as protected statuses. This became effective September 11th. And just to remind you what we're talking about, gender identity is the individual's sense of their own gender that may or may not correspond with their birth sexual identity, the sexual identity assigned to them at birth. Gender expression is the individual's way of reflecting and expressing their gender to the outside world. So both of these situations are now covered under the Colorado Anti-Discrimination Act, and they are now protected statuses. Senate Bill 21-039 eliminated the ability of employers to pay employees sub-minimum wages. An employer needed to obtain a certificate from the United States Department of Labor authorizing payment of sub-minimum wages based on age, disability, or injury by July 1st to continue paying sub-minimum wages. But that deadline has come and gone. But even with a certificate, even if you have obtained a certificate to pay sub-minimum wages, you have to phase out some sub-minimum wages by July 1st of 2025. Okay. Another interesting bill, House Bill 21-1007 created a state apprenticeship agency. And this agency serves as the primary point of contact with the U.S. Department of Labor concerning apprenticeships and registered apprenticeship programs in the building and construction trades industry. The agency is charged with accelerating new apprenticeship program growth and assisting in promotion and development of apprenticeship programs, overseeing these programs, quality assurance, and compliance with federal laws and standards. That law went into effect on July 1st, and the agency will start accepting applications for apprenticeship programs on July 1st of 2023. House Bill 1065 allows private employers to give preference in hiring to veterans and spouses of veterans killed in the line of duty. The preference only applies to new hires and is limited to eligible candidates. So you don't have to give a preference to a candidate who may be a veteran but is not eligible to perform the job duties. Private employers can actively recruit and advertise for veterans regardless of whether they assert a hiring preference. And that bill also went into effect on September 11th. House Bill 21-1110 aligns state law with the minimum protections under the Federal Americans with Disabilities Act by updating definitions, and it prohibits persons with disabilities from being excluded from or being denied benefits of public entity services or state services, programs, or activities. So that protection went into effect on June 30th. House Bill 1050 made changes to the Workers' Compensation Act that affect, among other things, the timely payment of benefits, benefit offsets, the selection of independent medical examiners, limits on temporary disability and permanent partial disability payments, and petitions for review and appeals of orders. And that went into effect on September 11th. We also have another bill that concerns workers' comp. House Bill 21-1207 concerns overpayment of work comp benefits. It narrows situations where overpayments can be recovered from claimants as a result of fraud, omission, miscalculation, or clerical error. and it places the burden on carriers to bear the weight of mistakes or delays in the work comp process. You, as an employer, should expect premiums to go up as a result of this new statute, which will become effective on January 1st, 2021. We also have one more bill, Senate Bill 2021-8087, that addresses agricultural workers' rights. It authorizes agricultural workers to form unions and sets a minimum wage for ag workers at $515 a week, starting January 1st. Rest periods were already required for agricultural workers, but now meal periods are already required to be provided. So those are just some of the new things that are in place right now based on our recent legislative session. But I want to point out that you should watch, this is something you need to pay attention to. Watch for this in 2022. There was a proposed Power Act that would have expanded the ability of employees and independent contractors even to make claims under the Colorado Anti-Discrimination Act, to make claims under employers under the Colorado Anti-Discrimination Act. And it would have allowed claimants to go directly to court to file a lawsuit. They wouldn't have had to go through the typical Colorado Civil Rights Division administrative process where there's an investigation and a determination of cause or no cause. That would have been totally eliminated and claimants could go immediately to court and file a lawsuit. There was no opt-out for small employers. And what happened is this was postponed. It got postponed by the House Committee on Judiciary indefinitely. But the supporters of this bill are publicly committed to bringing this back next session. So keep an eye on this because this could have very serious consequences for all employers, big and small. And I also want to tell you about a big case, Nieto v. Clark's Market. On June 14th, in Nieto v. Clark's Market, the Colorado Supreme Court gave us the answer to whether an employer could have a policy that provided that earned but unused vacation pay was lost upon termination. Clark's Market's handbook policy said that if an employee failed to give 2 weeks notice, any earned but unused paid vacation was lost. But that was in conflict with the Colorado Wage Act that provides that vacation pay that is, quote, earned and determinable in accordance with the terms of any agreement between the employer and the employee is due upon separation. The parties conceded that the handbook policy was a contract, but the court held that private employers can't enter into a contract with employees that requires them to forfeit earned and accrued vacation pay. So the answer is yes, once vacation pay has been accrued, you can't enter into a contract with an employee to take that away upon separation. Okay, so what's coming up in the future? Well, the Family and Medical Leave Initiative, which also known as Prop 18, was passed in the last election, and we probably all know that. And so that's known as family. And under family, employees will be entitled to 12 weeks of paid time off for their own serious health condition, to care for a family member with a serious health condition. If the employer or family member is the victim of abusive behavior, sexual abuse, stalking, domestic violence, for military exigencies, or to care for a child in the first year after birth, adoption, or foster placement. Employees become eligible after earning $2,500, and the statute provides job protection if the employee has been employed for 180 days or more. That would be they're entitled to be returned to their exact same position. This is going to be funded by a state-run medical leave insurance program, and the premiums are paid by a 50-50 split between the employer and the employee. Each will contribute 0.45% of the employee's wages for a total of 0.9% total, which will be deposited in a state fund. And that will start January 1st, 2023. The fund deposits will start January 1st, 2023. But the employee's entitlement to take this type of leave doesn't begin until January 1st, 2024. local governments and school districts can opt out, but state employees are included. And employers with fewer than 10 employees are exempt. But even if the employer opts out, employees may opt into this program by paying their share of the premiums, and employers will have to give them the time off under this program. Okay. So don't forget, Colorado's minimum wage is expected to rise to $12.56 per hour in 22 based on inflation. And remember that under the Healthy Families and Workplaces Paid Sick Leave requirement, excuse me, that starts for all employers, including you employers with 15 or fewer employees. That obligation to start accruing 1 hour of paid sick leave for every 30 hours work will begin on January 1st, 22, and that's up to a total of 48 hours in a year. And the minimum salary level for exempt employees of private employers increases to $865.38 per week, or $45,000 per year on January 1st. So in order for an employee to be exempt, they have to meet that minimum salary level. Okay, thank you very much. And if you have questions, we'll take them soon. Okay.
Thanks, Barbara. One question really quick that came through. Can you clarify in terms of vaccination requirements and the 100 employee count? We have a lot of businesses that have seasonal employees and part-time employees. How does that factor into the 100 when you're counting to get to 100?
Okay, so as I mentioned earlier, they have not yet defined how to define what an employee is. So we're going to have to stay tuned to figure out whether or not seasonal employees, temporary employees, or joint employment. We don't know that yet.
Yep. Okay, great. Thank you.
Okay.
Next question, Kelly and or Roberta, in terms of, I know that Roberta, you touched on it a little bit, but signs for staying home and not going into work. I know there's been a lot of conversation about, is allergies, is a cough. If you can just hit home a little bit more on that, I think that would be really helpful.
Right. And, the symptoms that we look at for a lot of our respiratory diseases are sore throat, cough, fever, and, runny nose. Those types of symptoms tend to, be reflective of influenza, COVID. I mean, if you get influenza, sometimes it feels like you just were hit by a Mack truck. I mean, it's got a very quick onset and you're kind of down for the count. So why you want to get your flu vaccine. So yeah, I would say we have had some people say, oh, I just think it's allergies, and it turns out to be COVID. It's allergies can be dependent on the person. So, we've got a lot of options for testing and free testing. It doesn't hurt to just go get tested, and staying home or, working from home if you have that option, just to make doubly sure, or even putting on a mask. I've seen people that are wearing masks because maybe they're getting over their cold. So, a lot of our respiratory etiquette of staying, social distancing, washing your hands, all of those can play into that as well. Kelly, I don't know if you have other tips that you guys are giving out there as well, because these respiratory diseases all seem to present very similarly.
They do, but separate from COVID or respiratory, we also say no fever or diarrhea for at least 24 hours without medication. So if you're still having to take ibuprofen or Tylenol to keep your fever down, you need to stay home. And those are kind of our general rules, just like you talked about.
And one thing I wanted to note is, we're very distinctive of COVID-19 is that loss of taste and smell. So as soon as that happens, regardless if you have the runny nose or the other symptoms, it's probably going to be COVID, unfortunately.
Thank you. And the push for getting your flu vaccine starts started in September and we want everyone to get them by a certain date?
As soon as possible.
Okay.
Again, you know, with flu vaccine, it's never too early to get your flu vaccine. Once it's available, you should get it. The flu vaccine is recommended for everyone 6 months of age and older. And again, as with other immunizations, it takes about 2 weeks for your body to develop that full immune response after vaccination. So the sooner you can get it on board before holiday gatherings, travel, those types of activities, the better. And we do have flu vaccine available in our community.
Great, thank you. I have not seen any other questions come through. So, and we are nearing the end of the hour. So I'll go ahead and wrap up. Roberta, Kelly, and Barbara, can't thank you enough for providing these updates to our membership today. We really appreciate it. And I would just, wrap up. We will for sure get this information that's been shared out to all of the registered attendees today. So you have those links in your inbox soon, and then we'll share it with our membership as well. And with that, we'll link off to our website that also lists out a lot of employer and employee resources in case you need to tap into any of those. Otherwise, I hope that everybody gets outside and enjoys this fantastic day, even for 2 minutes. Get a little vitamin D. Thank you for joining us. We'll talk to you soon.